Here's something that might surprise you. Calcium deficiency can be sneaky. In the early stages, you might not notice any symptoms at all. Your body is pretty clever. It tries to maintain normal calcium levels in your blood by borrowing from your bones. That means a standard blood test might show normal calcium levels even when your bones are slowly being depleted. This is why understanding these warning signs is so crucial. The good news? Calcium deficiency, also known as hypocalcemia, is usually easy to treat once it's identified. But first, you need to know what to look for. So let's jump right into the 12 signs that might indicate you're running low on this essential mineral. Sign number 1. Fatigue and weakness. Let's start with one of the most common yet overlooked signs. Feeling unusually tired, low on energy, or weak. Now I know what you're thinking. I'm over 60, of course I'm tired. But this isn't your normal end-of-the-day tiredness. This is a bone-deep exhaustion that doesn't seem to go away even after a good night's sleep. Here's what's happening in your body. Calcium is needed by your cells for energy production. When calcium levels drop, your cells become undernourished, leaving you feeling drained. Many seniors report a general lack of energy or muscle weakness when their calcium is low. You might find yourself needing to sit down more often, or perhaps that trip to the grocery store that used to be easy now leaves you exhausted. This happens because your muscles and nerves aren't getting enough calcium to function optimally. Think of calcium as the spark plug for your cellular engine. Without enough of it, everything runs sluggishly. You might notice that even simple tasks like climbing stairs or carrying groceries become more challenging. The fatigue can be so overwhelming that some people describe it as feeling like they're moving through molasses. What makes this particularly concerning for older adults is that this fatigue can lead to a vicious cycle. When you're tired, you're less likely to be active, and when you're less active, your bones get weaker, which can worsen the calcium deficiency. It's important to recognize this fatigue for what it might be, not just getting older, but potentially a sign that your body needs more calcium. Sign number 2, muscle cramps and spasms. Moving on to our second red flag, and this one can be quite literally painful. Have you ever been jolted awake in the middle of the night by a charley horse in your leg? Or maybe you've experienced sudden sharp cramps in your back or feet. These painful muscle cramps and spasms could be your body's way of telling you it needs more calcium. Calcium plays a crucial role in muscle contraction and relaxation. Without enough calcium, your muscles can misfire, leading to those painful cramps. You might notice achy muscles, stiffness, or even involuntary twitches, medically known as tetany. In older adults, nighttime leg cramps or spasms in the hands and feet can be particularly telling red flags. What's happening here is fascinating from a biological standpoint. Every time a muscle contracts, calcium ions rush into the muscle cells. When the muscle needs to relax, those calcium ions are pumped back out. If there isn't enough calcium available, this process gets disrupted. The muscle might contract when it shouldn't, or it might not be able to relax properly after contracting. For seniors, these cramps often occur at night because that's when you're not moving much, and blood flow to the extremities can be reduced. You might find yourself waking up with excruciating calf cramps that force you to jump out of bed and walk around. Or perhaps you notice your hands cramping up when you're trying to write or hold a book. The location of these cramps can vary, but they're most common in the legs, particularly the calves, and in the feet. Some people also experience cramps in their hands, arms, or even around their abdomen. The key thing to watch for is whether these cramps are becoming more frequent or severe. That could indicate your calcium levels are dropping. Sign number 3, numbness or tingling, pins and needles. Our third warning sign involves that strange sensation we often call pins and needles. A calcium deficiency can cause tingling or numbness in your extremities, often in the fingers, toes, or around the mouth. This isn't the same as when your foot falls asleep from sitting in one position too long. This is a persistent, sometimes concerning sensation that can occur without any apparent cause. This happens because calcium is crucial for proper nerve signaling. Your nerves use calcium to transmit messages throughout your body. When calcium levels drop, nerves become more irritable and can start sending mixed signals. Low calcium makes these nerves hyperexcitable, leading to that tingling sensation or even a burning feeling in your hands, feet, or lips. Many people describe this as feeling like tiny electric shocks or as if ants are crawling under their skin. You might notice it first in your fingertips or toes, as these are the areas farthest from your heart where nerve issues often show up first. Some people also experience this tingling around their mouth or lips, which can be particularly unsettling. What makes this symptom particularly important to recognize is that it's often one of the earlier signs of calcium deficiency. Your body prioritizes keeping calcium levels stable in your blood for critical functions like heart rhythm. So when you start experiencing these nerve-related symptoms, it's a sign that your body is struggling to maintain adequate calcium levels everywhere it's needed. If you frequently feel your fingers or toes getting numb or tingling without another obvious cause like cold weather or sitting in an awkward position, it could be due to low calcium levels. This symptom often comes and goes, which can make it easy to dismiss, but paying attention to patterns can help you identify if calcium deficiency might be the culprit. Sign number 4. Brittle bones and frequent fractures. Now we come to perhaps the most serious long-term consequence of calcium deficiency: brittle bones and frequent fractures. Chronically low calcium can lead to osteopenia or osteoporosis, conditions where bones become weak and brittle. This is where the sneaky nature of calcium deficiency becomes most apparent and most dangerous. Your bones act as your body's calcium reservoir. Think of them as a calcium bank account. When you don't get enough calcium from your diet, your body makes withdrawals from this account to keep critical functions running. Over time, if you're constantly making withdrawals without making deposits, that account gets depleted and your bones become weaker. Older adults might notice several warning signs of weakening bones. Loss of height is one of the first indicators. You might find that you're an inch or two shorter than you used to be. This happens because the vertebrae in your spine can compress or even develop small fractures. You might also develop a stooped posture, or what some people call a dowager's hump. But the real danger comes with fractures. Bones that used to be strong can break from minor falls or impacts that wouldn't have caused any damage in the past. A simple trip over a rug or a slip in the bathroom can result in a broken hip, wrist, or other bones. These aren't just painful, they can be life-changing injuries for older adults. What's particularly concerning is that by the time you're experiencing fractures, significant bone loss has already occurred. Studies show that after age 50, women can lose up to 1% of their bone density per year, and this accelerates after menopause. Men experience bone loss too, though typically at a slower rate until they reach their 70s. These are serious red flags that calcium and possibly vitamin D has been low for a long time. The tragedy is that much of this bone loss is preventable with adequate calcium intake throughout life, but especially during and after middle age when bone loss naturally accelerates. Sign number 5. Dental problems. Let's talk about a sign that might surprise you: dental problems. Tooth decay, weak roots, or gum disease can all be linked to calcium deficiency. Even though teeth aren't bones, they are anchored in the jawbone, which very much needs calcium to stay strong and healthy. When your body is low on calcium and starts pulling it from your bones, your jawbone is affected too. This can lead to teeth becoming loose or more prone to cavities. Older adults low in calcium might experience more frequent tooth decay, brittle teeth that chip or break easily, or even periodontal, gum issues, because the jawbone isn't as strong as it should be. You might notice that despite good oral hygiene, you're developing more cavities than usual. Or perhaps your dentist has mentioned that your teeth seem to be shifting, or that you have unusual bone loss around your teeth. These can all be signs that your body is scavenging calcium from your jawbone to use elsewhere. The connection between calcium and dental health goes beyond just the jawbone. Calcium is also important for the teeth themselves. Your teeth need calcium to maintain their hard protective enamel. Without enough calcium, this enamel can weaken, making your teeth more susceptible to decay and sensitivity. Some people with calcium deficiency also notice increased tooth sensitivity, especially to hot and cold temperatures. This happens because weakened enamel exposes the more sensitive layers of the tooth. You might find yourself wincing when drinking hot coffee or eating ice cream, even if you never had sensitive teeth before. What's particularly frustrating about dental problems related to calcium deficiency is that they can create a downward spiral. If dental issues make it painful to eat, you might avoid calcium-rich foods like cheese or nuts, further worsening the deficiency. This is why it's so important to address both the dental symptoms and the underlying calcium deficiency together. Sign number 6. Brittle nails. Our sixth warning sign might be right at your fingertips. Literally. Calcium is important for nail health, and weak, brittle nails that chip or break easily can signal a calcium deficiency. Take a moment to look at your nails. Are they strong and smooth, or have they become thin, ridged, or fragile? This occurs because low calcium affects the keratin structure in nails, making them less sturdy. Keratin is the protein that makes up your nails, but calcium plays a crucial role in how that keratin is formed and maintained. Without adequate calcium, the nail matrix, the part of your nail that produces new nail cells, can't function properly. You might notice several changes in your nails if you're low on calcium. They may become thinner and more flexible, bending easily when you'd expect them to stay firm. Vertical ridges might appear, running from the cuticle to the tip of the nail. Your nails might also develop a tendency to split or peel in layers, a condition called onychoschisia. Some people also notice white spots on their nails, though this is more commonly associated with zinc deficiency. However, calcium deficiency can cause the nails to become more opaque or develop an unusual texture. The rate of nail growth might also slow down. You might find you need to trim your nails less frequently than you used to. Of course, nails can weaken for many reasons: aging, frequent exposure to water, harsh chemicals, or other nutritional deficiencies. But when brittle nails occur alongside other symptoms on this list, they may point to low calcium intake. The good news is that nails can be one of the first things to improve when you start getting adequate calcium, as new, healthier nail growth replaces the brittle sections. Sign number 7. Dry skin. Moving from nails to skin, our seventh red flag involves changes to your skin's texture and appearance. Some seniors with low calcium report having dry, rough, or scaly skin. This might seem like a minor issue compared to broken bones or muscle cramps, but it's another way your body signals that something's not quite right. Calcium helps in skin cell growth and regulation, so a deficiency may result in skin that's drier or thinner than usual. The skin is constantly renewing itself, with old cells being shed and new ones taking their place. This process requires various nutrients, including calcium, to work properly. When calcium is low, this renewal process can slow down, leading to a buildup of dead skin cells and that dry, flaky appearance. You might find your skin is itchy or flaky even when using moisturizers. Some people describe it as feeling like their skin is always tight or uncomfortable. In more severe cases, the skin might develop a rough, almost sandpaper-like texture, particularly on the arms and legs. The skin might also appear dull or lackluster, losing that healthy glow. In severe cases, low calcium has been linked with skin conditions like eczema. While eczema has many causes, calcium deficiency can exacerbate existing skin conditions or make the skin more prone to irritation and inflammation. You might notice red, itchy patches that don't seem to respond well to typical treatments. What's particularly important to understand is that dry skin in older adults can have multiple causes: natural aging, medications, dehydration, or other health conditions. But if your skin's texture has changed noticeably alongside other symptoms on this list, it may be a clue that calcium deficiency is playing a role. The skin, being the body's largest organ, often reflects our internal health, including our nutritional status. Sign number 8. Coarse or thinning hair. Our 8th warning sign brings us to another visible change: alterations in your hair. Changes in your hair, such as hair becoming coarse, dry, or thinning, could be another red flag of calcium deficiency. While we often accept hair changes as a normal part of aging, significant changes in hair texture or thickness might indicate a nutritional issue. Calcium deficiency can slow hair growth and make hair more brittle. The hair follicles need various nutrients, including calcium, to produce healthy hair. When calcium is low, the hair that grows may be weaker and more prone to breakage. You might see more hair than usual on your brush, or your hair might feel dull and break easily when styling. Some people notice their hair texture changing completely. Hair that was once soft and manageable might become coarse and wiry. This happens because calcium plays a role in the hair's structure. Without enough calcium, the hair shaft can become irregular, leading to that rough texture. The hair might also lose its natural shine and appear lifeless. Thinning is another common issue. While some hair loss is normal with aging, excessive shedding or noticeable thinning could be related to calcium deficiency. You might notice your part getting wider, or you can see more of your scalp than before. For women especially, this can be distressing, as societal expectations often tie hair to femininity and youth. It's worth noting that hair is considered non-essential by your body. This means that when nutrients are scarce, your body prioritizes vital organs over hair growth, so changes in hair can be an early warning sign that your body doesn't have enough nutrients to go around. While many factors affect hair in older age, hormones, medications, stress, calcium, along with other nutrients, helps keep hair healthy. A deficiency can definitely show up in your hair's condition. Sign number 9, mood changes, irritability or depression. Now, let's discuss a symptom that might surprise you. Mood changes. Low calcium can affect mood and mental health in ways many people don't expect. Seniors who are low in calcium might experience unusual irritability, anxiety, or feelings of depression. This isn't just about having a bad day. This is about persistent mood changes that seem out of character. Calcium is involved in neurotransmitter release in the brain. Neurotransmitters are the chemical messengers that help regulate mood, and without adequate calcium, this delicate system can be disrupted. You might feel more blue or agitated than usual, snapping at loved ones over minor issues, or feeling overwhelmed by situations you'd normally handle with ease. The connection between calcium and mood is well documented in medical literature. Hypocalcemia, low blood calcium, has been associated with depressive symptoms, which often improve when calcium levels are corrected. This doesn't mean calcium deficiency is the only cause of depression in older adults, but it can be a contributing factor that's often overlooked. Some people describe feeling constantly on edge or anxious without any clear reason. Others report a persistent low mood, loss of interest in activities they used to enjoy, or a general sense of hopelessness. These feelings might come and go, or they might be constant companions. What's particularly challenging is that mood changes can affect your motivation to take care of yourself, including eating well, which can worsen the calcium deficiency. It's important to understand that the brain is incredibly sensitive to changes in calcium levels. Calcium helps regulate the release of serotonin and other mood-regulating chemicals. When calcium is low, this regulation can be thrown off, leading to mood instability. The good news is that many people report significant improvements in mood once their calcium levels are restored to normal. Sign number 10, cognitive issues, confusion or memory problems. Our 10th warning sign involves the mind itself. Brain fog, confusion, or memory lapses can be another sign of calcium deficiency. Your brain and nerves rely heavily on calcium to transmit signals properly. When calcium is low, older adults might notice they feel dizzy, forgetful, or just not as sharp as usual. This isn't just about normal aging-related forgetfulness. This is about noticeable changes in cognitive function. You might find yourself struggling to find words you know, getting confused about familiar routes, or having difficulty concentrating on tasks that used to be easy. Some people describe it as feeling like their thoughts are moving through thick fog. In more severe cases, hypocalcemia can cause significant confusion and disorientation. You might find yourself feeling lost in familiar places or having trouble following conversations. These cognitive symptoms are thought to arise because nerve cells aren't functioning optimally without enough calcium. Every thought, every memory, every decision involves electrical signals traveling through your neurons, and calcium is essential for this process. What's particularly concerning is that cognitive symptoms can be mistaken for early dementia or Alzheimer's disease. While calcium deficiency isn't a cause of these conditions, addressing any nutritional deficiencies is important for maintaining optimal brain health. Some people have been misdiagnosed with cognitive decline when the real issue was a correctable nutritional deficiency. The impact on daily life can be significant. You might find yourself needing to write everything down, missing appointments, or struggling with tasks that require planning or problem solving. If you or a loved one experiences increasing confusion or problems with thinking clearly, it's worth checking nutrient levels, including calcium, as part of the evaluation. The brain needs proper nutrition to function well, and calcium is a crucial part of that nutrition. Sign number 11. Irregular heartbeat. Our 11th sign is one that requires immediate attention: irregular heartbeat. Calcium plays a vital role in regulating heart muscle contractions. A fluttering, irregular, or unusually slow or fast heartbeat can be a serious warning sign of low calcium, especially if levels drop quickly. Your heart is a muscle, and like all muscles, it needs calcium to contract properly. But unlike other muscles, your heart can't afford to have cramps or spasms. Calcium helps coordinate the electrical signals that keep your heart beating in a steady, regular rhythm. When calcium levels are off, these electrical signals can become chaotic. You might feel palpitations, that sensation that your heart is racing, pounding, or skipping beats. Some people describe it as feeling like their heart is doing flip-flops in their chest. Others might notice their pulse feels irregular when they check it, or they might feel lightheaded or short of breath along with the irregular heartbeat. In severe calcium deficiency, dangerous cardiac arrhythmias, abnormal heart rhythms, can occur. These aren't just uncomfortable, they can be life-threatening. The heart might beat too fast, tachycardia, too slow, bradycardia, or in an irregular pattern that prevents it from pumping blood effectively. This is why sudden, severe calcium deficiency is a medical emergency. What makes this symptom particularly important is that heart problems can develop even when other symptoms are mild or absent. Your body prioritizes keeping calcium levels stable for critical functions like heart rhythm, so by the time heart symptoms appear, the deficiency is significant. If you ever notice marked irregular heartbeats or chest discomfort, along with other symptoms of low calcium, seek medical attention promptly. This isn't something to wait and see about. Your heart needs calcium to beat properly, and without it, serious complications can arise. Sign number 12. Seizures. Severe cases. Our final and most severe warning sign is seizures. In extreme cases, calcium deficiency can lead to seizures or convulsions, even in someone without a prior seizure disorder. This is the body's most dramatic cry for help when it comes to calcium deficiency. This occurs because calcium is critical for normal nerve and brain function. Very low levels can cause abnormal electrical activity in the brain, essentially causing an electrical storm that manifests as a seizure. The brain's neurons become hyperexcitable without adequate calcium to regulate their activity, firing in uncontrolled bursts. Seizures from hypocalcemia are uncommon and represent a medical emergency. They're a late red flag that calcium levels have become dangerously low. The vast majority of older adults will not reach this point, as milder symptoms usually appear first and prompt investigation. But it's important to know that uncontrolled muscle twitching or seizures can be related to severe hypocalcemia. Before a full seizure occurs, there might be warning signs. Some people experience muscle twitches that gradually worsen, involuntary movements, or periods of staring and unresponsiveness. These can progress to full-body convulsions if the calcium deficiency isn't addressed. This is why it's so important to pay attention to the earlier, milder symptoms on this list. If someone experiences a seizure and calcium deficiency is suspected, immediate medical treatment is necessary. Intravenous calcium can often stop the seizures quickly, which is why emergency room doctors often check calcium levels in patients presenting with unexplained seizures. This dramatic symptom underscores just how vital calcium is for our body's basic functions. Understanding your calcium needs. Now that we've covered all 12 warning signs, let's talk about how much calcium you actually need. As we get older, our calcium needs change, and in fact, women and men over 60 have higher recommended calcium intakes than younger adults. This might surprise you, but there are good reasons for these increased requirements. According to the Institute of Medicine and NIH guidelines, women age 51 and older need about 1,200 milligrams of calcium per day. Men age 51 to 70 need about 1,000 milligrams per day, but after age 70, men's requirement increases to 1,200 milligrams daily, matching that of women. So to summarize, women over 50 need about 1,200 milligrams of calcium per day, Men 51 to 70 need about 1,000 milligrams per day, and men over 70 need 200 milligrams per day. To put this in perspective, 1 cup of milk or fortified orange juice has roughly 300 milligrams of calcium, and a cup of yogurt can have 400 or more milligrams. That means women over 50 would need the equivalent of about 4 servings of dairy per day to meet their calcium needs through diet alone. Many seniors don't meet these calcium targets through diet alone, which is why it's important to be mindful of calcium intake. It's also important to know that there's an upper safe limit for calcium. For older adults, this is about 2,000 milligrams per day. More than that, especially from excessive supplementation, can be harmful. Too much calcium can lead to kidney stones, constipation, and in rare cases, calcium deposits in soft tissues. The goal is to meet your needs but avoid megadoses. Think of it as finding the Goldilocks zone. Not too little, not too much, but just right. Why seniors become calcium deficient. Understanding why older adults become low in calcium can help you prevent or address the issue. There are several common causes and risk factors, and often it's a combination of factors that leads to deficiency. First and most simply, many seniors just aren't getting enough calcium in their diet. Dairy products like milk, yogurt, and cheese are the richest calcium sources for most people. But many seniors eat less dairy due to lactose intolerance, which can develop or worsen with age, or due to dietary choices. If your diet lacks dairy or fortified alternatives like fortified plant milks, juices, or cereals, you might not reach the needed calcium intake. Over years, this insufficiency can lead to deficiency. Vitamin D deficiency is another major culprit. Vitamin D and calcium go hand in hand. They're like dance partners, and you need both for the dance to work. Vitamin D is needed for calcium absorption in the gut. Without it, you could eat all the calcium-rich foods in the world and still be deficient because your body can't absorb it properly. Older adults often have low vitamin D due to less sun exposure. Maybe you're not outside as much, or you're vigilant about sunscreen, which is good for skin cancer prevention, but reduces vitamin D synthesis. The skin also becomes less efficient at producing vitamin D as we age. If vitamin D is low, even a calcium-rich diet may not be enough. This is why doctors often recommend calcium and vitamin D together for seniors. For women, postmenopausal hormonal changes play a huge role. After menopause, women's bodies produce much less estrogen. Estrogen helps bones absorb and retain calcium, so when it drops, it's like removing a protective shield from your bones. The drop in estrogen causes accelerated bone loss, about 1% of bone density per year on average. This hormonal change means women 50 and over are at high risk for osteoporosis if calcium and vitamin D intake isn't increased. It's a key reason the calcium RDA is higher for older women. Medications and medical conditions. Various medications that are common among older adults can contribute to calcium deficiency. Long-term use of proton pump inhibitors, PPIs, for acid reflux is a big one. These medications, while effective for managing heartburn and GERD, can reduce calcium absorption in the gut. If you've been taking omeprazole, esomeprazole, or similar medications for years, your calcium absorption might be compromised. Some anti-seizure medications can interfere with vitamin D metabolism, which indirectly affects calcium. Corticosteroids like prednisone, often prescribed for inflammatory conditions, can accelerate bone loss and interfere with calcium absorption. Certain diuretics used for blood pressure management can increase calcium loss through urine. Medical conditions can also play a role. Hypoparathyroidism, where the parathyroid glands don't produce enough hormone, directly affects calcium regulation. Chronic kidney disease can interfere with vitamin D activation and calcium absorption. Digestive disorders like celiac disease, Crohn's disease, or even just age-related decreases in stomach acid can all impact how well you absorb calcium from food. As we age, our digestive system becomes less efficient at absorbing calcium. We produce less stomach acid, which is needed to dissolve calcium and make it available for absorption. The intestinal lining might not be as healthy or efficient as it once was. Even with a good diet, absorption can be hampered. It's like having a leaky bucket. You can pour in plenty of water, but if there are holes, you won't retain as much as you need. Lifestyle factors, that deplete calcium. Certain lifestyle choices can deplete calcium or weaken bones, and it's important to be honest about these factors. Smoking is a major one. Tobacco use accelerates bone loss and interferes with the body's use of calcium. Long-term smoking in both men and women leads to significantly lower bone density and a higher risk of fractures. The chemicals in cigarettes interfere with the cells that build bone and can affect hormone levels that protect bone health. Excessive alcohol is another calcium thief. Heavy alcohol intake reduces calcium absorption and can harm bone-forming cells, leading to weaker bones. Alcohol interferes with the pancreas and liver, which are important for calcium and vitamin D absorption and metabolism. Moderation is key. More than 1 drink a day for older women or 2 for men can speed up bone loss. Even moderate drinking can be problematic if combined with other risk factors. High caffeine intake might surprise you as a risk factor. Drinking a lot of coffee or caffeinated beverages can increase calcium loss in urine. For every cup of coffee you drink, you lose about 2 to 4 milligrams of calcium. While this might not seem like much, if you're drinking multiple cups a day and already struggling to meet calcium needs, it can add up. The effect is more pronounced if your calcium intake is already low. Moderate caffeine is usually fine if you get enough calcium, but very high amounts might pose a risk. Perhaps the most overlooked lifestyle factor is inactivity. A sedentary lifestyle can contribute significantly to bone loss. Bones stay strong when they bear weight. It's a use it or lose it situation. When you're inactive, your bones don't get the signals they need to maintain their strength. Lack of physical activity can worsen the bone-thinning effects of calcium deficiency. Even if you're getting enough calcium in your diet, without physical activity to stimulate bone maintenance, you can still lose bone density. Solutions: addressing calcium deficiency through diet. The good news is that calcium deficiency is treatable, and there are many ways to improve calcium levels and bone health. Let's start with the first line of defense: diet. Including high calcium foods in your daily meals is the best way to meet your calcium needs naturally. Dairy products remain excellent sources of calcium. An 8-ounce glass of milk provides about 300 milligrams of calcium, while a cup of yogurt can provide 400 milligrams or more. Hard cheeses like cheddar or Swiss are particularly calcium-rich, with about 200 to 300 milligrams per ounce. If you can tolerate dairy, these foods offer calcium in a highly absorbable form. But what if you don't consume dairy? There are plenty of other options. Fortified foods can be your best friends. Calcium-fortified orange juice, plant-based milks like almond, soy, or oat milk, and fortified cereals can provide just as much calcium as dairy products. Check labels carefully. Not all plant milks are fortified equally. Other calcium-containing foods might surprise you. Canned salmon and sardines with soft bones are calcium powerhouses. A small can of sardines can provide over 300 milligrams of calcium. The key is eating the soft bones, which might take some getting used to, but are perfectly safe and highly nutritious. Tofu made with calcium sulfate is another excellent source, providing about 250 to 750 milligrams per half cup, depending on the brand. Don't overlook plant sources. While they're not as calcium-dense as dairy or fortified foods, vegetables like kale, collard greens, bok choy, and broccoli contribute meaningful amounts of calcium. Almonds are among the best nut sources, with about 75 milligrams per ounce. White beans, figs, and even blackstrap molasses contain calcium. The key is making sure each meal has some calcium source. For breakfast, you might have fortified cereal with fortified plant milk or yogurt with berries. Lunch could include a salad with canned salmon or sardines. Dinner might feature tofu stir-fry with bok choy or pasta with a sprinkle of Parmesan cheese. Snacks could include almonds, cheese, and crackers, or a smoothie made with fortified milk and leafy greens. The vitamin D connection. We can't talk about calcium without emphasizing vitamin D. It's not enough to eat calcium-rich foods if your body can't absorb the calcium, and that's where vitamin D comes in. Vitamin D helps your intestines absorb calcium from food and helps your kidneys retain calcium that would otherwise be lost in urine. For older adults, the recommended vitamin D intake is generally 600 to 800 international units, IU, per day, though some experts recommend even higher amounts for seniors. You can get vitamin D from several sources. Fatty fish like salmon, mackerel, and tuna are among the best food sources. A 3-ounce serving of salmon provides about 450 IU of vitamin D. Egg yolks, fortified milk and orange juice, and fortified cereals also contribute vitamin D. Sunlight exposure is another way to get vitamin D. When UV rays hit your skin, they trigger vitamin D synthesis. However, this becomes less efficient with age, and many seniors don't get enough sun exposure. Factors like living in northern climates, spending most time indoors, or always wearing sunscreen can limit vitamin D production. Even in sunny climates, older skin is less efficient at producing vitamin D. Many seniors need a vitamin D supplement, especially in winter, or if they have limited sun exposure. But here's the important part. Don't just start taking high doses on your own. Ask your doctor to check your vitamin D level with a simple blood test. They can then advise an appropriate dose. Too much vitamin D can be harmful, but the right amount will ensure the calcium you consume can be absorbed efficiently. Smart supplementation. If it's hard to get enough calcium from food alone, supplements can help bridge the gap. But supplementation requires a thoughtful approach. Not all calcium supplements are created equal, and more is definitely not better when it comes to calcium pills. The two main types of calcium supplements are calcium carbonate and calcium citrate. Calcium carbonate is less expensive and contains more elemental calcium per pill, but it needs to be taken with food for best absorption. Calcium citrate costs more but can be taken with or without food, and might be better for people with low stomach acid. Your pharmacist or doctor can help you choose the right type. Here's a crucial point. Your body can only absorb about 500 to 600 milligrams of calcium at a time. Taking a mega dose of 1000 milligrams or more at once means much of it won't be absorbed. Instead, split your doses. If you need 1000 milligrams from supplements, take 500 milligrams in the morning and 500 milligrams in the evening. This maximizes absorption and minimizes side effects like constipation. Always check that your calcium supplement includes vitamin D, or take them together. Many combination supplements are available that provide both nutrients in appropriate ratios. Read labels carefully. The amount of elemental calcium is what counts, not the total weight of the compound. It's important not to exceed the recommended amount. Excessive calcium from supplements can cause kidney stones, constipation, and in rare cases, calcium deposits in arteries. The goal is to use supplements to reach the recommended daily amount when diet falls short, not to take as much as possible. Think of supplements as filling the gap, not replacing a healthy diet. Exercise, your secret weapon. While diet and supplements are important, exercise might be your secret weapon against calcium deficiency and bone loss. Physical activity, particularly weight-bearing exercise, is crucial for bone health. It's not just about building muscle. It's about sending signals to your bones to stay strong. Weight-bearing exercises are activities where you work against gravity. Walking is one of the simplest and most effective. Aim for at least 30 minutes of brisk walking most days of the week. Dancing is another excellent option. It's weight-bearing, improves balance, and is enjoyable. Tai Chi has been shown to improve bone density while also reducing fall risk through better balance. Resistance training is equally important. This doesn't mean you need to become a bodybuilder. Light hand weights, resistance bands, or even bodyweight exercises can help maintain bone density. Simple exercises like wall push-ups, chair stands, or bicep curls with light weights can make a difference. The key is consistency. Doing a little bit regularly is better than intense workouts once in a while. Even if mobility is limited, chair exercises can help. Seated marching, arm raises with light weights, and resistance band exercises can be done safely while sitting. Pool exercises are excellent for those with joint problems. The water provides resistance while reducing impact on joints. Exercise does more than just strengthen bones. It improves balance and coordination, reducing the risk of falls. It strengthens the muscles that support your skeleton. It improves mood and energy levels, which can help with those fatigue and depression symptoms we discussed. And it creates a positive cycle. The more active you are, the stronger your bones become, and the better you feel overall. Lifestyle changes for better bone health. Beyond diet and exercise, several lifestyle changes can significantly improve your bone and calcium health. If you smoke, quitting is one of the best things you can do for your bones. Smoking has been shown to accelerate bone loss and interfere with the body's ability to use calcium. Former smokers have lower bone density than never smokers, but quitting at any age can help slow further bone loss. Your bones will thank you, and so will the rest of your body. Moderating alcohol intake is another important step. If you drink, keep it to no more than 1 drink per day for women or 2 for men. Consider having several alcohol-free days each week. When you do drink, make sure you're also focusing on good nutrition. Alcohol can interfere with nutrient absorption, so it's extra important to eat well. Managing medications is crucial. If you're on long-term medications that can affect calcium, like PPIs for acid reflux or steroids for inflammation, talk with your healthcare provider. Never stop prescribed medications on your own, but ask if there are alternatives or if you should take extra steps like calcium and vitamin D supplements or periodic bone density tests. Sometimes simple adjustments or monitoring can prevent a medication from causing calcium problems. Creating a bone-healthy environment at home can also help. Ensure good lighting to prevent falls, remove trip hazards like loose rugs, install grab bars in bathrooms, and keep frequently used items within easy reach to avoid risky climbing or stretching. Preventing falls is just as important as strengthening bones. When to seek medical help. Knowing when to seek medical help is crucial. If you suspect you're low on calcium, perhaps you recognize multiple red flag signs, or know your diet is consistently low in calcium, it's worth discussing at your next doctor's visit. Don't wait for symptoms to become severe. Your healthcare provider can review your diet, possibly do blood tests for calcium and vitamin D, and check your bone density if needed. A bone density test, called a DEXA scan, can show if you have osteopenia or osteoporosis. Blood tests can reveal if your calcium and vitamin D levels are in the healthy range, though remember that blood calcium can appear normal even when your bones are being depleted. Be prepared to discuss your symptoms, diet, medications, and lifestyle factors. Keep a food diary for a few days before your appointment to show what you typically eat. List all medications and supplements you take. Be honest about lifestyle factors like smoking, alcohol use, and activity level. This information helps your doctor provide the best care. Based on the findings, your doctor might recommend dietary changes, supplements, or in some cases, medications for bone health like bisphosphonates. These medications are usually reserved for more advanced bone loss, but they can be very effective when needed. The key is catching problems early, when simple interventions like diet and lifestyle changes can make the biggest difference. Special considerations for chronic conditions. If you have chronic health conditions, managing calcium becomes even more important. People with diabetes need to be especially vigilant, as the disease can affect bone health through multiple mechanisms. High blood sugar can interfere with bone formation, and diabetes complications can increase fall risk. Those with heart disease might worry about calcium supplements after hearing about potential cardiovascular risks. Current research suggests that getting calcium from food is safe and beneficial, while high-dose calcium supplements might pose some risk. Work with your doctor to find the right balance. You need calcium for bone health, but it should be obtained safely. Kidney disease presents unique challenges. The kidneys play a crucial role in calcium metabolism and vitamin D activation. If you have kidney disease, your calcium needs might be different, and supplementation requires careful monitoring. Never take calcium or vitamin D supplements without your nephrologist's approval if you have kidney problems. For those with digestive disorders like inflammatory bowel disease or celiac disease, calcium absorption can be significantly impaired. You might need higher intakes or special forms of calcium. Working with a registered dietitian who understands your condition can be invaluable. The mind-body connection. The relationship between calcium and mental health deserves special attention. We mentioned mood changes and cognitive issues as symptoms of calcium deficiency, but the connection goes deeper. Maintaining good calcium status isn't just about preventing physical symptoms. It's about supporting overall well-being. When your calcium levels are optimal, your nervous system functions better. This can mean clearer thinking, more stable moods, better sleep, and an overall sense of well-being. Many people report feeling more like themselves once calcium deficiency is corrected. The fog lifts, the irritability fades, and energy returns. This creates a positive feedback loop. When you feel better mentally, you're more likely to take care of yourself physically. You might be more motivated to exercise, prepare healthy meals, and maintain social connections. All of these factors contribute to better bone health and overall health. Don't underestimate the psychological impact of conditions like osteoporosis. Fear of fractures can lead to reduced activity and social isolation. But knowledge is power. Understanding your risks and taking proactive steps can help you feel more in control and less anxious about your bone health. Building a support system. Managing calcium intake and bone health doesn't have to be a solo journey. Building a support system can make the process easier and more enjoyable. Consider joining a walking group or exercise class designed for seniors. The social aspect makes exercise more fun, and you're more likely to stick with it. Involve family members in your health goals. Maybe a spouse or adult child can join you for walks or help with grocery shopping for calcium-rich foods. Share what you've learned about calcium deficiency. They might recognize symptoms in themselves or want to prevent future problems. Consider working with healthcare professionals beyond your primary doctor. A registered dietitian can help create a meal plan that meets your calcium needs while considering other health conditions. A physical therapist can design a safe exercise program tailored to your abilities. A pharmacist can review all your medications for potential interactions with calcium. Online communities and local senior centers often have resources and support groups focused on bone health. Sharing experiences and tips with others facing similar challenges can be encouraging and educational. Technology and tools. Modern technology offers tools to help manage calcium intake and bone health. Smartphone apps can track your calcium intake, making it easier to see if you're meeting daily goals. Some apps have extensive databases of foods with calcium content, including restaurant meals. Fitness trackers can monitor your daily steps and remind you to move regularly. Many have features specifically designed for older adults, with larger displays and simplified interfaces. Some can even detect and alert emergency contacts. Pill organizers with alarms can help ensure you take calcium and vitamin D supplements consistently and at the right times. Smart pill dispensers can alert caregivers if doses are missed. Online resources from reputable organizations like the National Osteoporosis Foundation, NIH, and major medical centers offer valuable information, recipes, and exercise videos designed for seniors. Many offer free materials you can download and print. Planning for the future. Taking care of your calcium needs now is an investment in your future independence and quality of life. Strong bones mean you're more likely to stay active, maintain your independence, and enjoy activities you love. It's never too late to start improving your bone health. Consider your calcium intake as part of your overall health planning. Just as you might plan for financial security and retirement, plan for physical security through good nutrition and healthy bones. This might mean making gradual dietary changes, slowly increasing activity levels, or working with your doctor to optimize medications. Set realistic goals. Maybe start by adding one calcium-rich food to each meal, or commit to a 10-minute walk daily, gradually increasing as you feel stronger. Small, sustainable changes are more likely to stick than dramatic overhauls. Keep learning. Nutritional science continues to evolve, and new research emerges about bone health in aging. Stay informed through reputable sources, but always discuss major changes with your healthcare provider. The bottom line. Let's recap what we've learned about calcium deficiency and its warning signs. We've covered 12 red flags that might indicate your body needs more calcium: unusual fatigue and weakness, painful muscle cramps and spasms, numbness or tingling sensations, brittle bones and fractures, dental problems, brittle nails, dry skin, coarse or thinning hair, mood changes like irritability or depression, cognitive issues including confusion and memory problems, irregular heartbeat, and in severe cases, seizures. Each of these symptoms can have other causes, but when several occur together, calcium deficiency should be considered. The sneaky nature of calcium deficiency means it can progress silently, borrowing from your bone bank account until significant damage is done. We've learned that adults over 60 have higher calcium needs, found 200 milligrams daily for women over 50 and men over 70, with men 51 to 70 needing 1,000 milligrams. Meeting these needs requires attention to diet, possibly supplements, adequate vitamin D, and regular physical activity. The causes of calcium deficiency in seniors are varied, from simple dietary insufficiency to vitamin D deficiency, hormonal changes, medications, medical conditions, and lifestyle factors. Understanding your personal risk factors helps you address them effectively. Most importantly, we've seen that calcium deficiency is both preventable and treatable. Through dietary changes, appropriate supplementation, regular exercise, and lifestyle modifications, you can maintain healthy calcium levels and strong bones well into your golden years. Your action plan. Now it's time to turn knowledge into action. Start by honestly assessing your current situation. How many of the warning signs do you recognize? What's your typical daily calcium intake? Are you getting enough vitamin D? How active are you? Make an appointment with your healthcare provider to discuss your bone health. Ask about getting your calcium and vitamin D levels checked, and inquire about a bone density test if you haven't had one recently. Bring a list of your medications and supplements for review. Begin making dietary improvements immediately. Add one calcium-rich food to each meal. If you don't consume dairy, explore fortified alternatives. Try new recipes incorporating calcium-rich ingredients. Remember, food sources are generally preferable to supplements. Start or enhance your exercise routine. Even a daily 10-minute walk is beneficial. Add simple resistance exercises using light weights or bands. Consider joining a class designed for seniors. The social aspect adds motivation. Address lifestyle factors within your control. If you smoke, seek help quitting. Moderate alcohol intake. Ensure your home is safe to prevent falls. Stay socially connected and mentally engaged. A message of hope. If you've recognized yourself in many of these symptoms, don't despair. Calcium deficiency is common in older adults, but it's also very manageable. Simple changes can lead to significant improvements in how you feel and function. Many people report dramatic improvements once their calcium status improves. The fatigue lifts, the muscle cramps disappear, mood stabilizes, and that mental fog clears. Bones can stabilize and even improve with proper treatment. Your body has a remarkable ability to heal and strengthen when given the right nutrients and care. Remember, it's never too late to bone up on calcium. Whether you're 60 or 90, taking steps to improve your calcium status can enhance your quality of life. Every positive change you make, no matter how small, is a step toward better health. You have the knowledge, you have the tools, and you have the power to take control of your bone health. Start today, be patient with yourself, and celebrate small victories along the way. Your future self will thank you for the investment you're making now in stronger bones and better health. Stay informed, stay active, and most importantly, stay hopeful. With proper attention to calcium and overall bone health, you can maintain your independence, reduce fracture risk, and enjoy an active, fulfilling life for years to come. Here's to your health and strong bones.